healthcare evolves, so has nursing education, training, and practice.
And who better to talk about these changes than the Dean of the College of Nursing at Roseman University. Dr. Brian Oxford joins us now, along with Assistant Professor Marika Chunick. Welcome to the show.
Good morning.
Thank you for having us.
Great to have you. We're so happy to highlight this amazing degree. It's a Master of Science in a Family Nursing Practitioner, so it's an MSN-FNP. Tell us about this wonderful opportunity for working nurses.
So the MSN-FNP is a degree, it's an advanced degree graduate program that allows practicing registered nurses to move to the next level, what we call advanced practice registered nursing. And in this case, these individuals are trained to diagnose, treat, and evaluate patients very similar to physicians.
Great.
Wonderful. And so how would you say nursing education and practice has changed?
So in the education realm, nurses primarily, historically were trained in hospitals and diploma programs. And then it moved into higher education, and there were two levels. There was the associate degree program that still exists today, and then the 4-year bachelor's degree program, which is what we offer at Roseman. And then, as we see now in the graduate realm, we have grown to both master's levels and doctorate levels, both in practice degrees like the MSN-FNP as well as others.
Excellent. And do you have this degree yourself?
Yes, I'm a family nurse practitioner, and it's nice to have an advanced degree because we have such autonomy. And there's like 27 states where we can practice on our own. We can have our own practice. We can see patients, treat, diagnose, and everything pretty much a physician can do.
It's really an elevated level of nursing. What's the motivation for a nurse to get this degree?
Well, to have the autonomy and to be able to see and treat patients and see them from the whole aspect of nursing, to see and treat them from a holistic and a whole body approach to seeing the patient and taking it through from treatment to diagnosing and everything.
Wow, wonderful. So how would you say Roseman's practices, or programs rather, differ from other programs?
So Roseman, we've been here in the Valley for over 20 years now, and we're a very unique model. We have a 6-point mastery learning model that involves a block curriculum, competency-based education, assessment is used as part of learning, a group process, early experiential exposure, and our classroom designs facilitate interactions with students and faculty different than their traditional classrooms.
And so for many or all of the students going through this program, they're already practicing nurses and they're just looking to take that to the next level. Maybe you can share some stories of people who have come into the program at different stages in their career and decided, hey, it's time for me to step this up.
So we've offered this degree since 2019, and we've had both a mixture of alumni as well as individuals who have gone to outside schools. We've graduated 3 classes of advanced practice registered nurses now, and they're all working in different locations, mostly in California, Utah, and Nevada.
Great, staying in the area.
Staying in the area.
That's what we want.
At our Utah campus, we have one fairly recent graduate who was also one of our faculty members, and she's actually just opened a practice in Utah because Utah just became the 27th state to become full practice authority for the advanced practice nurse. So she has her own practice.
Interesting.
It's very exciting.
That is incredible.
Do you have any stories to share as well as other nurses, friends of yours perhaps, who've really...
So some nurses go into it like maybe with only 2 years experience and they just want to advance their degree. Others have had like over 10 years experience and have a vast variety of areas that they've worked in. And as a nurse practitioner, you can go into family practice. You can also go into working in the hospital. You can also go into working in urgent cares. There's a lot of different avenues that you can work in.
Excellent job possibilities.
Oh yeah, absolutely. Is there anything else from Roseman that you'd like to share?
Yes, we'd like to share that we do offer this MSN-FNP program twice a year, starting in July and January. Our current application cycle closes May 8th, so if you want to start the journey, the 2-year journey, our July start, May 8th is the application, and then if you're not ready for that, our January cohort is right around the corner, so applications will be opening soon.
Excellent.
Wonderful.
Yeah.
What a great program for local nurses. Thank you so much for
Yes,
sharing.
thank you for having us.
You're welcome.
Yes, if you would like to know more information on Roseman University's nursing program, visit nursing.roseman.edu. You can also call the phone number that's right there on your screen.